Next, we have a CMP, or Comprehensive Metabolic Panel. There's a simpler version called the Basic Metabolic Panel, also called the Electrolyte Panel. These are going to have all your electrolytes and a few extra things that all have to do with your metabolic processes. The first one listed here is sodium. Normal is 135 to 145. Now, sodium is a big regulator of blood volume, blood pressure, and the pH in the body. It also has a lot to do with osmotic equilibrium, along with potassium. This is going to keep the equilibrium between cells and interstitial fluid. Potassium, like I said, osmotic equilibrium, and also very important is nerve function. It's going to be involved in membrane polarization. So if your potassium levels get too low or too high, you can actually have cardiac arrhythmias, muscle spasms, that kind of thing. I have 3.5 to 5 listed as the normal range. I know some places say normal is as high up as 5.2, 5.3. I've even seen 5.5. But the basic, as long as you get the basic idea, that it's around 3.5 to 5. Like I said, if you can remember back in your pathophys days, sodium and potassium are involved in the pump that's right on the cell membrane there, the ATP pump, and that's how they're involved with osmotic equilibrium. Next we got chloride, which is 98 to 110. Give or take a few, depending on where you went to school at or where you work. Chloride is used in metabolism. It's actually vital for the process of turning food into energy. Our kidneys tightly regulate chloride. We have calcium, which is 9 to 10.5. As I'm sure you know, calcium is extremely important in bone formation. If those levels get low, the serum level is actually going to correlate with your bone levels as well. Women often have a problem with calcium levels as they age due to menopause. So too low can be quite detrimental. Next is magnesium. Normal is 1.3 to 2.1. Magnesium is very important in our body. It's needed for most catalytic reactions. There's over 300 enzymes in our body that use magnesium. So magnesium is vital. Even though it's in small doses in our blood, it's extremely important, and physicians are often very aggressive in terms of treating hypomagnesemia. I've seen magnesium given to patients with levels around 1.2, 1.3, as opposed to when somebody has a low sodium level, it's not so aggressive with it. Phosphorus is 3 to 4.5. Phosphorus is also important in the regulation of magnesium and calcium levels. Then we have glucose. Glucose is 70 to 110. Now this may differ from what you learned. I know when I was in nursing school, I learned 80 to 120. Now, there's a lot of research out there that shows that tight glucose regulation, keeping it below 110 is correlated with positive outcomes and good outcomes in the hospital. Also, the lower end, having 70 as the lower limit is probably different than what you learned in school. But most hospitals, you will not treat a low blood sugar or hypoglycemia until it's below 70. So to me, if you're not going to treat it, then it's not really that abnormal. And normal healthy people can have glucoses in the mid-high 70s, and it's not out of the ordinary. CO2 is 22 to 28. Keeping in mind that this is venous blood, a CMP and a CBC should always be drawn out of venous blood. BUN and creatinine, these are the primary measurements of kidney function. BUN is 7 to 22, creatinine is 0.5 to 1.4. Now the more important of these two is the creatinine level. Physicians and nephrologists tend to look at creatinine more often. The BUN can really vary a lot more person to person and depending on protein intake. So creatinine is important. Your protein and albumin levels. The protein and albumin in your blood is very important. First of all, for onconic pressure, it'll actually hold volume in the blood vessels and stop it from leaking out into the extravascular space. But proteins and albumin are also very important for binding purposes. They will bind to most pharmaceuticals that you take, but they also bind to a lot of vitamins, minerals, and nutrients that your body transports. So your protein levels are very important. The next few here is alkaline phosphatase. You got your ALT and AST. These are hepatic enzymes, so they'll be elevated during liver problems like cirrhosis, acute or chronic hepatitis, and also in liver failure. Bilirubin can also be increased during liver disease, but bilirubin can also be elevated during gallbladder inflammation or some sort of gallbladder disease or a duct obstruction as well. One thing that bilirubin is involved with is in red blood cells. So if you have severe hemolysis or some sort of hemolytic anemia, your bilirubin levels will be elevated. These last four levels there, the liver enzymes and bilirubin, don't tend to be excessively low, and if they are, they're not gonna affect you because you want these to stay low.